Your ribs are the long curved bone surrounding your chest. It extends all the way back to your vertebrae, your backbone. In total, we have 12 pairs of ribs. Your first to seventh pair are known as your true ribs. They are connected to both your sternum, your breastbone, and your vertebrae. The 8th, 9th, and 10th pairs are known as false ribs. They are indirectly attached to your sternum through your last pair of true ribs, the 7th pair. The final 2 pairs are known as floating ribs. These 2 pairs are only connected to your vertebrae. They get their name floating as they seem to be floating from an anterior view. These 3 types of ribs form your rib cage. Your rib cage protects a lot of your vital organs such as your lungs and heart. Although there are many types of fractures, they can mainly be divided into 2 categories: a simple fracture and a compound fracture. A simple fracture is when you break a bone but it remains inside your skin. It's also known as a closed fracture. A compound fracture, on the other hand, is far more painful as the bone that's broken comes out of your skin, and that is why it's known as an open fracture, because it opens up your skin. When one or more of the bones in your rib cage break or crack, it's known as a rib fracture. Your cartilage, the thick tissue in your rib, may also be damaged as the bones that are broken are very sharp and may cut your soft tissues. Fractured rib may cause different degrees of pain to different individuals when any sort of pressure is applied to the injured area. Swelling is very common for someone who had just fractured their rib. You can tell if you have a fractured rib if you find it difficult to breathe in. If it is particularly painful in a bruised area due to an accident, you should seek medical advice from a doctor. Osteoporosis is a medical condition which causes bones to be fragile. This condition often leads to the fracturing of ribs, as even something as simple like coughing can crack a bone in a rib cage. The most common cause of a fractured rib is when a person who was involved in a car accident gets directly hit in the chest. Another example of the causes of fractured ribs would be contact sports like football and rugby. Getting a fractured rib puts your lungs in a high risk of getting bruises. This could lead to many breathing difficulties. It is important to consume prescribed painkillers if you feel pain breathing. It will reduce the degree of the pain when you inhale and exhale. Recovery usually takes up to 6 weeks, but this may vary from one individual to another, as different people have different healing factors. If your organs are not injured, you can let your body heal itself while you rest at home. To speed up the recovery time, keep your lungs active. Try and do slow breathing exercises every day. If the painkillers do not relieve the pain, you can gently press a pillow against your chest to absorb the impact. This would definitely reduce the degree of the pain. Towards the later stages of your recovery, lifting weights may help, but make sure not to use weights that are too heavy, as that would apply indirect pressure to your ribs through your chest, which would damage your ribs even more. Shoulder shrugs is another simple exercise you could do to help speed up the recovery. To avoid fracturing your rib, or any bone in that case, make sure you get enough calcium and vitamin D. There are many exercises you can do to strengthen bones, like push-ups or sit-ups. Make sure you avoid smoking or excessive drinking so that your bones do not get damaged. Thank you for watching.